If I have photos, I can't see the moment like us, but I can see it.
Join the club. Yeah, you're on.
Okay, do you want to verify we have quorum?
So, welcome, thanks for coming.
Yes.
When I call your name, please let me know that you are here. Aaliyah Armstrong. Amanda Archer. Here. Dan McIntyre.
Here.
Faith Dayton.
Here.
Jeanette Ornelas. Here. Joanne Brewer.
Here.
Joseph Ditto.
Yeah, my bad. Yeah, I'm here, I think.
Judy Albert. Here. Kate Mather. Here. Paul Davis.
Here.
Teresa DeSimone.
Here.
Reese Martinez.
Here.
We have a quorum.
Okay. Is there any public comment that was not on items that are not on the agenda? Seeing, we'll move on to the approval of March 18th COC board minutes. They're attached. Are there any additions or corrections to those minutes?
Counterclockwise, so it wasn't always shut. Just give us come down. I should see such. I grabbed that plastic and I popped tire. I think that's what I told you. Don't do it again right now.
There's no corrections on the motion to approve.
Make a motion to approve the March 8th minutes,
March 18th, please. Is
March 18th.
there a second for that motion?
I second.
Any discussion? Roll call, Veronica?
Yes, it was the plastic was.
When I call your name, please say yes, no, or abstain. Amanda Archer.
Yes.
Dan McIntyre.
Yes.
Faith Dayton.
Yes.
Jeanette Ornelas. Joanne Brewer.
Yes.
Joseph Ditto.
Yes.
Judy Albert.
Yes.
Kate Mather.
Yes.
Paul Davis. Teresa DeSimone.
Yes.
Reese Martinez.
Yes.
Motion approved.
Yeah, we're gonna go on to updates from jurisdiction. Since Megan's not here, do you have an update, Veronica?
I wasn't given any updates and she's supposed to be here, so,
Well, we'll just skip her for now.
okay.
Nobody from the city of Ukiah, city of Fort Bragg, Jeanette.
No, just an announcement. I brought, the Plateau Housing Project is having a resource fair next month, for local agencies or individuals that are currently housed or going to be housed there. And I think that's probably it.
Okay, cool. Any questions for Jeanette?
Well, you want to do stuff.
We'll just pass them around.
Yeah, I don't have.
If we need to make more copies, we can.
Okay, we'll go on to city of Point Arena, Peggy.
Not present.
Are there any other jurisdictions that are here that I missed that I've listed? There's Megan. You have a county update?
Oh, gosh. Why is it so quiet?
I was being nice, but I got you scared of
Great,
me, but
Do I have a county update? No, everything's pretty calm and quiet in the county right now. Don't think I have any updates of significance.
we'll move on to standing committee reports then.
So Dan, can I ask a question?
Yeah.
Does anyone ever try to do outreach to the city of Willits? Or any
Yeah.
kind of-
We have.
Okay. It just seems always strange that you hear nothing.
I've reached out,
From the
I don't hear much.
Huh?
I've reached out multiple times to the city manager, the assistant city manager. There's a shelter advisory group that's in Willits that they're trying to put together a shelter up there. And so they're forming a nonprofit and that it's just a bunch of invested folks, sometimes church members, sometimes not. And so they're looking into possibly doing services up there. But as far as the jurisdiction itself, the emails that I had for them, I still have Brian Bender, the city manager, on the mailing list, so he gets our agendas every month. And several of the emails that I had for the city of Willits, I got rejections from that they weren't working. So I had to eliminate those. One was like willitscitycouncil@gmail.com or something, so it just wasn't working.
Okay, all right, thank you. I just was wondering.
Yeah.
I don't have anything for strategic planning committee. We haven't met for a while. So shelters and solutions, Veronica, do you have anything?
Dick's not here, we're going to meet in July. And no updates.
Coordinate entry, Veronica?
There's a lot going on in that committee, which I'm very excited to be able to report. I'm working on purchasing a subscription to a learning management system through Talent LMS. And this is a training platform where we can upload videos or quizzes or information. It's a platform where people can log in so we can track who's attended and who's done what. We can issue certificates. And so that's in the works. We have the training videos drafted. We're going through some edits right now. We're working on revising the screening form to reflect the 2024 data standards. What else? I'll talk about that under HMIS. And we're working on formulating a referral process through coordinated entry. That's technically the way that the HUD expectations and requirements are, is that we don't just develop a list of folks, but those people who we've screened need to be directed to the permanent housing projects, the CDC, the programs they have, the Plateau or Creek Commons. They're not supposed to let us know when they have an opening. We're supposed to let them know, here are some folks who are eligible for your program so that when you do have an opening, they're ready to go. And so that's the next evolution in our coordinated entry system. And so we're working on putting that together. But our first step is to get everybody trained so that all clients are assessed equitably and in the same, no matter where they go. We're working on expanding our coordinated entry assessors locations. And that comes with the training. Like I said, the LMS is the last piece. We're waiting for that. Referrals, training. I think that's enough for now. Any questions?
I always have questions. So, so the coordinated entry right now to the only place is building bridges, right?
No, Hospitality Center.
I know, oh, well,
For anyone who's
in your
just
file, the inland area kind
inland area, yes.
of, okay. And so when you said we're hoping to get more people trained and to get an equitable assessment that would be across the line, you're thinking of maybe opening up another center besides.
Northern Circle has already agreed. They're just waiting for our training.
Okay. And is the VI SPDAT still being used?
So that was the other piece that I forgot. I knew there was another piece. Through implementing the HUD data standards that are tracked in HMIS under the coordinated entry referral process. So it's like, it'll be logged into HMIS when a referral is sent. And then that housing provider says, we got it. And then maybe 3 months later, they select that client. All of that is going to be tracked in HMIS. We need that data to tell us who's getting housed and who's not. Who's getting housed quickly and who is not. That's the information that we need in order to develop a locally equitable assessment to replace the VI SPDAT.
Okay.
Yes, so that is our goal, but what we've learned through HUD TA and community collaboration is that we don't know enough about our outcomes to be able to determine if they're equitable or not. So we don't have any data. We have data. We don't have the data that tells us the information we need. And so we need to more robustly use HMIS through coordinated entry to comply with HUD requirements so that we can draw those conclusions.
But right now, is HUD requirements, like my understanding with the VI SPDAT is that it captures those who have been perhaps the longest chronically homeless and also having other perhaps attributes such as some substance mental health issues. So that they would get a higher number so that they would be the ones who would first be referred to get housing.
That's mostly accurate. The piece that I would clarify is it doesn't prioritize length of homelessness. It's where you're physically at, like a person who's unsheltered would get more points than somebody who's in a shelter. Is that right? So I wouldn't say, so yes, but it's not length of time homeless. It's where they're experiencing homelessness.
One of the elements is.
Is it? I'm not
One of the-
up with it.
One of the elements is length of time homeless, and one of the elements is where they're, if they're sheltered or unsheltered, if they're, and then there's the screening is heavily weighted to prioritize people with, physical, mental, and substance use health challenges. And then after that, secondary is like risk and, resources. That's one of the elements looked at as well. And then we have some local prioritization factors that we've added into the screening as well to be able to go, like, we want to extra prioritize families, we want to extra prioritize veterans, we want to prioritize people with, like, so we've changed added some scoring elements that weight it heavier if someone has a history of domestic violence, or if they're a family with kids, or if they're a veteran, or they have
Or
a senior. So there's some elements in there that we've looked at locally to go, we want to put extra emphasis on these particular target populations.
And there's some nationally collected data that shows the VI SPDAT will not adequately assess some minority groups. The way that a white person experiencing homelessness may be different than the way a Black person experiences homelessness versus the Native American. So, but our tool is the research was highly white. It was 85%. That community that it was developed for was 85% white. So you take it and apply it to a community where it's only 40% white, you're going to get major inequities. So we don't know if it's an equitable look. We just don't have the data to be able to demonstrate it one way or the other. So this is our plan to get the data.
And also, do we have any data in terms of how frequently there are actually openings in the housing that we have available?
Not yet, but that would be something that would be collected under this new process.
I think, Judy, I just had the same conversation with Veronica a few days ago, because I was like impatient to get a new tool. And when I understood all of the other pieces of the coordinated entry infrastructure that need to be perfected, I'm still not totally on board with waiting to before, but that is the philosophy that the coordinated entry committee is taking. And it certainly has merit, but it is going to be a long time, I think, until it sounds like it's going to be a long time until the coordinated entry system is at a place to reassess that tool. Which, you know, for the COC, I don't know how impatient everybody is, but for me, if it takes several years, I think that would be a problem. If it takes like a year, that really might be what happens. I don't know.
It's going to depend on how quickly our housing providers come on board with the referral process. and how quickly our coordinated entry. I guess they're not really assessors at that point. They do the assessing and then there's additional steps that need to be done. So it's whoever's doing those additional steps. So we've kind of got to build that into it, which we're working on through like the RCS front door contract and, you know, MCO coming on and, you know, and so.
Yeah, I think there's been some, I was super encouraged when I haven't been to the housing Mendo meeting in a long time, but I went to one like last week or whenever. The amount of progress that's been made is really remarkable. I mean, the list is clean. It's like up to date. People are matched to who they are. I mean, it's like night and day compared to what we were struggling with several years ago when it was all super voluntary and, you know, there was nobody assigned to do that work. So the progress is remarkable. And Veronica just made reference to this, but as soon as we can get the board of supervisors to approve it, which might be tomorrow, RCS is finally going to have a funded contract to do coordinated entry with like paid staff.
Oh, good.
They are being required to have some phone hours. So for those providers that going down building bridges is not the most like realistic thing, or I think there will be some phone hours
Mhm.
to practice with. So I think there's going to be a lot of momentum really soon in getting coordinated entry really up to speed.
Like I want to clarify a little bit on we've been doing phone screenings at B2 since we opened. So we get a lot of folks that we screen that are not in Ukiah and don't come in physically. And just don't expect miracles to happen out of B2 and coordinated entry because we've been a front door for coordinated entry. Like 75% of the people screened for coordinated entry have been getting done through building bridges. We just have been doing it as like in addition to the things that we've been doing. And now we finally have a funding stream to support it happening in a real way. But it's not going to like, I don't think drastically change in terms of like, we're still going to see those same people that we've been screening already, just in a way that can help with the funding. It can sustain that continuing to happen.
I totally appreciate you're trying to manage expectations, and it is true. Most of the referrals have already been done by B2, but we have not, as a COC, been able to. Everything that our CS is doing is like a favor. So we are going to be monitoring it more closely because we actually are putting funding into it and we should see a change, I would think, because we are going to be able to have dedicated staff, more advertised phone hours. That's more specific. So I think that the COC has chosen to invest specifically in coordinated entry and we are seeing the outcome. I think seeing the change, but we're not yet at the point of abandoning the VI SPDAT, which I'm anxious to do, but it might just take a little bit of time.
Oh my, y'all are anxious. Yeah, we got to do it right. So there was a community in Arizona that did it before they had the data and it made the inequities worse.
Right. So that's a good point. You don't want to.
Just throw away the thing that is working better than what we had before. Because I think that's another piece to remember is that the VI SPDAT and the prioritization that our community is doing way better for our community in terms of equity than first come, first serve was. And so like, we don't want to throw it out the window before we really have a good idea of what's going to be a better system. And also keeping in mind that just because even if we stop calling it the VI SPDAT doesn't mean we're throwing away some of the questions. There's definitely data points and things that are considered in the VI SPDAT that are valuable. And so how do we as a community get to a place where we own it as this is our coordinated entry screening and prioritization tool, whether or not it includes questions that are on some other tool with a different name? That it's something we as a community own. We're closer, we're doing that better than we were 5 years ago. We're doing it infinitely better than we were 10 years ago, and we can still do it better.
I think we're also seeing, I mean, what I notice is we're seeing a much higher rate of both people getting successfully enrolled in PSH and finding housing. Like we are seeing movement through the system in a way that I don't think we had seen as much before. So it's really promising. I have not, I'm not a fan of coordinated entry, like generally speaking, and I'm much more like on board after having seen the growth in the last couple of years.
Any other questions for Veronica? We'll move on to membership committee, Veronica.
This one has escaped me. And I haven't done the work under this one.
Under membership committee?
Yes.
We did so much membership work. We probably had a break in the last month because we did so much work getting ready for the new board.
Yes. But our July meeting's supposed to be our new recruitment. And we should have had something out already. So I will convene a meeting ASAP.
I have a question related
Yes.
to membership committees. Just like for membership engagement and everything else, I noticed there's 3 people sitting at the table that I don't know, and I don't think that some of us might not know who they are, and I think it's really great for membership engagement to acknowledge that and to have them introduce themselves. Cause I'm super excited to see these people and I don't know who they are and we just. Hi. So
We're members of the public and I just,
well, welcome
Didn't make
members of the.
back.
Nice to meet you all. I just think it's good for engagement too, because we want to encourage people to feel comfortable. And I love to be bossy and share my opinion. And I just think it would, if I were you, I'd be more comfortable if somebody acknowledged my presence. So, and all of you, so. Welcome.
Well, I'm Estelle. I'm with McCavan Care and Prevention Network. I'm the ERS coordinator over there and it started in April and came to tag along with Joe.
That's awesome. You're a board member here, so great. Nice to meet you.
Nice to meet you too.
Hi, so I'm Valerie Singh and I'm from the Global and Humanitarian and NGO. We just have a small office in Ukiah and the reason I came here is because last year we did some outreach of, sleeping bags, backpacks and like carbs this year, so we got more. And then we did it with only a few volunteers, so we're trying to figure out how to organize it for the end of the year. It's usually a winter outreach. Yeah, but I have some brochure I can share with people later.
Well, we're so happy that you're here.
Thank you.
Yeah, nice.
Thank you for having.
And I would recommend that you connect with Faith as well as
Okay.
Paul Davis. There you are, Paul.
Oh,
Because they both do street outreach.
yeah, oh, great.
And so they probably will have some ideas on how to.
Yeah, we can talk
Okay,
afterwards.
Yeah.
And then, I don't know if we've met either.
Oh, Jeanette's beautiful, right?
Were these new faces for everybody or just me?
Jeanette's a board member. She's been around for a while.
Maybe just online. Yeah. Okay. Sorry, I just went for engagement. I just remember my first time and I didn't know anybody and it was like crickets. So, and it didn't make me feel like I wanted to engage. So that's why I wanted to acknowledge it. So thank you for letting me in.
And McCavan also does outreach in the community.
Oh, that's right. I'm sorry. My apologies. Usually you do it hand in hand, so. Okay, that's it for membership committee, unless anybody else has anything. All right, I'm taking.
HMIS is next.
We have an item on the agenda. There's a few revisions to our HMIS partner agreement, partner agency agreement. So we've been working on that and that'll come up later in the meeting. The committee work is going well. There's the May data completeness report card available in here. Remember, street outreach programs don't have to collect all of this information. So if you see any street outreach projects that have a low grade, that's why. It's because they don't have to collect it because, I mean, when you engage with somebody on the streets, you're not going to ask them their social security number the first time you meet them, and so HUD makes that exception. But our report doesn't have a way to really account for that. But it looks like we've got A's across the board on this one. That's all I have.
Any questions on the data completeness report? And now we'll move on to the ad hoc for point in time in the head count.
The executive report is almost complete. The HUD reports have been submitted. They were submitted on time. We're gonna have some regional information that we haven't had in the past. And I'm hoping that we'll have a presentation for that at the next meeting.
The July meeting, is that right?
The July meeting, yeah.
Any questions on head for pit? Okay, we'll move on to board protocol and governance.
Dan, one thing I forgot to mention. I wanted to bring up now, since we're under ad hoc, that I haven't been able to engage with Community Care Corporation, a management corporation. They were awarded $450,000 for prevention and diversion services. Their executive director, they had change over in their ED. And I haven't been able to get in touch with the new ED. She had a personal loss and has been on family medical leave. I've been trying to engage, but I wanted the COC board to be aware that I have not been able to move forward with that contract negotiation. And I was wondering if the board had any direction or if they want to form an ad hoc. Another item is they announced today, the legislature and the governor have agreed on a budget that includes $1 billion for HAP Round 6. So we'll have more funding coming down past HAP 5. And so we'll probably need to form a funding ad hoc committee, if not just for HAP 5. So
Let me see if I can, they rent space from us. So let me see if I can get you in touch with them.
That's a good question. But the expenditure deadline date for the funds that they were gonna be awarded.
26, 27?
26, 27.
Yeah, we have lots and lots of time.
Okay.
They give us 5 years, but usually we have it spent within 3.
Yeah.
So it's longer than we.
But I mean,
Just in terms of like.
it is, yeah, it is. I do want to note that they submitted an application, a fairly ambitious application, and their communication has not been great with the organization that chose to award them money. So Veronica and I did talk about like a deadline of some real clarity from them, because if they're not going to be able to do this work, which is totally fine, we need to reallocate it so those services are not lost in our community. So I feel pretty big, strong sense of urgency on it. Veronica's been very clear, but a little bit, and we've been patient as well. So we're done being patient. So we're gonna get it
Family
really soon.
happen.
Yeah, and there was a turnover and all that, yeah.
Let me see if I can get on.
Okay. No ad hoc yet.
What?
No ad hoc yet.
I mean, we can create an ad hoc if you want to,
I know.
help funding, just so it's done. Or we can do it the next meeting.
I think I would suggest we wait another month, maybe two, not for them. I mean, I don't think we need to form an ad hoc right now, because I would like to be really clear on what our directions are to that ad hoc first. And whether they're reallocating money or coming up with a framework for HAP 5 and 6, like we're not totally clear on that yet.
All right, so we're gonna go down to board protocols and governance, the terms. So I'm gonna go over this briefly and then I'll let Veronica deal with it. As everybody's aware, we did elections in the last general membership meeting in order to cycle board terms so that we're basically have a group of 4 expiring every year, and we don't have them all expire at one time. Some of the new terms are only 1, some are 2 years, and some are 3 years. So to make it as random as possible, those that don't have terms that have an expiration date, like mine, I think expires next year. But we'll be drawing a number out of the bucket. That doesn't mean you're valuable or less valuable. It just puts you on the correct cycle for the elections. And it could be 1 year, 2 year, or 3 year.
So I have
Being said,
here's one,
it's not a cobble.
two, and I'm just gonna go around and have you pick one.
So why don't let's have him say it. So Jeanette is picking a number and is telling her how many years do you have?
The ones that were voted in at the last.
2 years. Okay, so she's got a 2-year term right now.
I have 3.
3? Wait, okay, wait.
I don't have to do it for free.
Okay. Jeanette, you had 2.
That's a 5.
Seven.
7.
Two.
Okay, so 2 was, I haven't. Oh, you got 3, so you got 3? Okay.
Not every 2 years.
No, you'll just be on the tier.
I'll go to it.
Paul, what 3 or 2?
I see for 3 years.
1,
We're not going
okay,
anywhere.
okay.
They just put you on a cycle, so you're either elected next April,
One.
following April, or the following.
Let's see, who do we have left here?
I think I'm out of whack in 2020.
What is it?
I had 2020.
What? You're 3. Okay.
I'm sorry.
And then Amanda, what'd you get? One. Okay, I missed. McCavan, you got two?
Yes.
And Paul, you got two?
Yes.
Okay, I'm gonna read it out to people. So, Priest, his new end date will be the May meeting of 2027.
That's 3 years?
That's 3 years.
I know.
Okay.
Are we all gonna be gone by then?
We're gonna have golf.
Oh,
Lisa, you are here for 3 more years. Your term date is 5/2027. That's not probably April. We'd be super official here because you were elected in May. Okay, so April 2027.
Okay.
Joanne, your term is up in April 2025.
1 year?
1 year. Judy, your term is up in April 2027, 3 years. Amanda, you've got 1 year. Term is up in April 2025. All right, Paul, you have 2 years. Your term is up in April 2026. McCavan, 2 years, April 2026. Jeanette, City of Fort Bragg, 2 years, April 2026. And Kate, Nation's Finest, 1 year, April 2025. Okay, so now we have a kind of appropriate cycling.
And now we have to do a motion and approve that.
Do we?
I don't know.
We probably don't.
well, you could do it to approve it, but really not.
We need to find somebody to start the motion.
Why don't you do it?
What am I saying?
You're making a motion to,
approve the things we just did.
Yeah, no, Sage just moved it. Sage started it.
oh, she.
Someone needs to
I
second.
second it.
Okay. Sage first. Faith second.
Second.
Okay.
So rope a dope.
Now we have to vote.
So when I call your name, say yes, no, or abstain. Amanda,
Yes.
Dan,
Yes.
Faith,
Yes.
Jeanette.
Yes.
Oops. Joanne,
Yes.
Joe,
Yes.
Judy,
Yes.
Kate,
Yes.
Paul,
Yes.
Teresa,
Yes.
Trees.
Can you please repeat that motion? Just kidding, yes.
Motion approved.
All right, so that's the last time we'll ever have to do that. Now we're on a cycle where they should.
Don't curse me like.
I know, I should be.
Let's acknowledge all the work
Oh my
that
God,
they,
it's fun
that
time.
you guys put into this whole
Don't
project.
curse us by saying that. because
No, I know, okay, but,
Last time we were on a cycle, COVID hit us. And then-
oh, that's right, everything got messed up. Okay, so we are good. Nobody is up for reelection until a full year from now.
Oh, that's cool.
Yes.
All right, so the next thing, we have to nominate and elect chairs and vice chair, a chair and a vice chair.
Oh, should those have been,
Veronica,
separate?
what? Chair and vice chair?
Oh, my God.
Technically, yeah, but we can handle those two different motions.
Sorry, details. So we need to select the chair and a vice chair for this board.
Would you like me to facilitate this a bit?
Yeah.
Okay, is there anybody who would like to nominate themselves to be chair? Is anyone very excited about being chair? Okay, is there anyone,
No,
is there anybody who would like to nominate somebody else to be a chair?
I would nominate Dan McIntyre.
Dan, would you accept that nomination?
Yes.
Is there anybody else who would like to nominate anybody else to be chair?
We only get one chair, right?
Yeah,
Yes.
Okay, sorry, chair.
No,
So we
no,
don't
no,
need to
I'm just seeing if there's anybody, I'm being fair. If somebody else wants to nominate someone besides Dan, please do. Since I would say nobody was eager to do it. Okay, so,
Do we have a second for Dan?
do we have a second for nomination?
We're doing.
We'll all second. We're doing just chair. We're doing chair first.
we're just,
And then we'll-
should have been split on.
Okay, okay, we have a motion on the table to nominate Dan McIntyre for chair. Nobody else has put forward a nomination for anybody else for chair.
Uh-huh.
Do we need a second?
Second.
Seconded by Joe.
Let's move it along.
Okay, all those in favor of Dan McIntyre?
I think we should do vice chair,
Before we go
and
back,
then we make one motion for both, and then
All right.
we do a roll call.
is there anyone who would like to nominate themselves to be vice chair? Is there anyone who would like to nominate somebody else to be vice chair?
I'm gonna nominate you.
I can't do it.
It has to be the
Paul.
You're gonna nominate Paul as vice chair?
Yeah.
Okay, Paul, are you willing to accept that? Paul's willing to accept that. Does anybody else want to nominate anybody else besides Paul to be vice chair?
I have
Okay.
like 10 seconds to think.
So we
about it.
I'll second that.
Did you make the motion then?
No, he made the.
Oh, that's right, Dan made it.
What does the vice chair have to do? I'm sorry. I just don't know.
Run away.
Yeah.
Typically, there's not a
There's
ton,
not a, in the new
This
configuration.
isn't a
there's not
challenge to Paul.
yeah.
In,
I respect.
in the new configuration, there's not a ton of, in the new configuration, you fill in for the chair when the chair is absent,
Okay.
but other than that, not much.
And I send the
More back
draft
early.
agenda to the chair and the vice chair, and they both approve it.
They, I will say, behind the scenes, they are not wielding a great deal of power.
No. We sign up,
Not really,
we sign a few letters here and
all the real things that happen do happen. I just.
If there's something that he's conflicted on,
Yeah,
then
that's true.
Do I see anybody that is interested in being vice chair that just needs to get nominated out here? I'm looking at. Okay, just looking around.
Okay. So we had a motion to nominate Paul for vice chair. Priest seconded it. So now we have two motions on the table for Dan and Paul as chair and vice chair. And since they've both been made and seconded it,
yes.
I think we could just vote.
Abstain.
Okay.
We've had a year. So I'm gonna do a roll call vote for the motion to approve Dan McIntyre as chair and Paul Davis as co-chair. And we'll get the minutes all fixed.
Your reception better be good, Paul.
So when I call your name, please say yes, no, or abstain to the motion on the table. Amanda? Yes. Dan?
Yes.
Faith?
Yes.
Jeanette? Joanne?
Yes.
Joe?
Yes.
Judy?
Yes.
Kate?
Yes.
Paul?
Yes.
Teresa? Yes. Priest?
Yes.
Motion approved.
Thank you.
Congratulations.
Yeah. And I don't mean to I mean, Dan, I'm really grateful Dan's still chair, but I do want to appreciate Paul is fairly new to be in this vice chair position and we appreciate that, especially the coast representation. So
And just,
thanks, you guys make a good team.
and just as a side note, I don't get to vote anymore, so don't call me for anything.
I know.
Oh, that's interesting.
Only
That's
in
right.
case of a tie.
That's right.
Why don't, wait, what?
That's what we wrote in our government.
We have 12 members, so the chair only votes if there's a tie-breaking situation. Okay.
Steve, Mr. Chair.
Carry on, Mr. Chair.
All right, so next thing we're gonna talk about revisions to the HMS partner agreement. All, myself, Veronica, and the rest of the HMS committee worked on this over what, last couple meetings, right? Last two meetings we had. So we're recommending board approval of it. I believe it's included in the packet, correct, Veronica?
Yes, starting after the board nomination, I forgot to number the pages, sorry.
So it's the one that we changed the title to says participation, privacy and data sharing agreement. It was not very clear that it was for participants, like. Especially for me, that's why, but, is there any questions on this? I think the biggest change is in C, which is on the second page of the packet. Veronica was gonna explain that.
So this was something we added at the request of Paul Davis. The HMIS vendor contract between the county of Mendocino and WellSky includes what is called a business associate agreement, which basically requires both parties to comply with HIPAA. Paul asked that if we could demonstrate that this is included in our system and in our contract so that he can demonstrate to other partners that our system indeed does comply with HIPAA as, like, they're gonna protect the data. in that same level. So
The vendor.
Well Sky isn't gonna share it, Well Sky is gonna protect it. It's not about how we locally use it, it's between the county and the vendor. And so this was something he just wanted to have in there. Paul, can you maybe explain a little bit more? I'm doing a poor job here.
That's about it. I mean, you know, if you're gonna be compliant, most of the time they want to know that you have a business associate agreement with all your vendors, including the people that lease your copy machine, and it's kind of a weird thing. It's the same, especially mental health. We don't really have a direct relationship with the software vendors. Folks do, but there's still a time to be able to show that that's in place with somebody, that somebody's responsible for that. It's helpful if you're having your risk assessment.
Any questions?
There was one more, I added an appendix A. Because the agreement includes contact information for HMIS lead. But that information might change, and instead of having to change this agreement every time and sign new ones, if that ever was changed, we pulled it out and put it in appendix A so that appendix A can be changed, which is a lot easier than just redoing a whole agreement every time. So those were the three primary changes: the name change, the business associate agreement, and appendix A.
Questions for the board?
I do. How soon do we get these when you do make document changes so we could go before meetings?
Say that one more time, I'm sorry.
When you get a document that's about ready to change, when do we get them before the meetings?
You say we, you mean a board member?
Yeah,
We would post, we provide it with the agenda at least 72 hours in advance of the meeting.
okay.
We've been doing it in the HMIS committee for the last 3 months, and those are publicly noticed. So this has been publicly noticed since at least 2 weeks ago, 2.5 weeks ago.
But the draft for approval wouldn't be sent directly to the board until those 72
hours before. And I
That's just information for me to know.
yeah.
But so many different boards you sit on, they all have different hours and dates.
Yeah.
Yeah. 72 hours at minimum.
Okay.
I think I sent it Wednesday, so it was a little earlier than that.
It's a good question. Thank you for asking questions. That helps all of us. I didn't know either.
If there's no questions, I need a motion for approval.
I'll move.
Is there a second? Second. Any further discussion? Roll call, Veronica?
Yes, no, or abstain when I call your name. Amanda. Yes. Dan.
Yeah.
Oh, wait, I don't call. That's a second now. Okay, okay. You know what? We're gonna do this.
You should have seen the look he gave you.
You don't get the vote anymore. Hey,
Abstain.
Jeanette,
Yes.
Joanne.
Yes.
I mean, yeah, no, that's right. Joe,
Yes.
Judy,
Yes.
Kate,
Yes.
Paul,
Yes.
Teresa. Yeah. Priest.
Yes.
Motion approved.
Yes.
Yeah.
Okay, so there's no other updates on the other funding. We're gonna go down to projects, Veronica. Is that? It is you. AB 271?
Yes. So in your packet,
Sorry. What? You said no updates on any other funding, but is CSG on there?
oh,
CSG?
There's no update, but there's a
ESG.
comment on ESG,
Yeah. Go ahead.
which is that it is driving me crazy because it is taking so long for ESG to review and
Still
approve.
haven't approved it yet?
We still have not gotten approval. I reached out to them last week and they said that they were reviewing it in some blah, blah, blah meeting thing somewhere and.
When is it supposed to normally?
So normally we would hear back in like March
Oh,
on where we're at and it's still just pending with no, like, they're just ghosts. So if anybody has any contacts at ESG people, like, I mean, I thought I did, but they're not talking to me. I know what's going on.
it's not.
It'd be really nice to know where we stand.
I don't know where we stand. But, so right now the state housing agencies are going through major restructuring. All of the contracts under HAP are being moved from Cal ICH to Housing and Community Development, or HCD. And so they're in the process of doing all of that. It doesn't go into effect until the budget goes July 1. And so any of the contracts that either one of them have been working on, they're all on hold until it's all sorted out and we're under the new budget year. I know at least that much.
So, short end of the answer, having worked with HCD for the last 3 years, don't expect anything faster.
It's not fast. We applied in October.
I'm just saying it takes months.
Well, so it's anxiety creating because we have clients that are on rapid rehousing assistance that we're gonna have to cut off from rapid rehousing assistance before they're ready because we don't have a renewal contract.
Let's look into transfers before we do that. Okay.
I do have a meeting tomorrow with HCD, so I will ask who I can beat on the head. That person I'm talking to doesn't know it. AB 271.
Yes. In your packet, there is a printout of a newsletter. There's there's an entity through one of the universities in the Bay Area called the Hub for Urban Initiatives. And they have a newsletter called the Homeless and Housing Strategies for California. And the one that I've included is titled Dying While Homeless is a Burgeoning Crisis in California that Necessitates Systemic Changes. And it's information on Assembly Bill 271 that authorizes counties to establish a homeless death review committee. And so they can bring together different departments throughout the county, like the coroner and Office of Medical Investigator or Medical Examiner reports. So there's all kinds of processes around establishing a homeless death review committee. This is authorized to counties, so counties have to establish it. But I wanted the COC to be aware that this exists. There isn't one locally in Mendocino County. And the COC might be interested in advocating to form one. So I wanted you to be aware, provide this information and go from there. Any questions?
I'm very interested in this. And so how are other counties doing this?
So there's some, it's pretty new. Honestly, if it's not in the report, I don't know much about it.
Okay, yeah, I just hadn't heard and I don't read that fast, or I've read this yet. So, but yeah, because this is definitely something that the hospital and just my personal background would be interested in supporting or however we can. But maybe I should do more research into what the purpose is.
Looks like there's one in Orange County.
Okay.
And there is a homeless mortality toolkit to help create it. So there's a toolkit that's linked in this. I did forward this out as well, but I wanted you guys to have, I wanted to bring it up specifically in this forum and to inform members of the public as well.
You? COC representative to Mendocino County Reentry Cooperative.
So this is something I brought up a few meetings ago. The Mendocino County Reentry Collaborative is going pretty strongly. They're looking at strategies to improve connection to services for folks in the jail who are being released. There's a big focus on people who are being released into homelessness. And so I know in other boards or collaboratives, sometimes the COC will have a representative that goes and represents the COC. They don't really, I have a conflicting meeting during the regular time, so I can't commit to attending, and I kind of feel like it needs to be a board member. So I wanted to continue bringing that up to see if anyone's interested or willing.
Do you know when they meet?
They meet
Is it once a month though, or is it every quarter?
once a month. I think it's the second Thursday.
Is anyone already regularly going? You go,
Yeah.
Jeanette, and you
Yeah, I'm
go,
looking for a day right now.
you go, Joe?
I have staff that goes, yes.
Yeah, we have stuff.
Alright, so yeah, it's the second Thursday at 1:30.
So I believe this board, it wasn't just Veronica, I'm pretty sure a couple of meetings ago, this board said that they wanted to appoint somebody as a representative, so.
But we wanted to wait till the
new board was established, that's right,
before someone, because we didn't want to send somebody and have it change.
That's right.
So that's on you guys to determine if that's something you want to do or who wants to do it.
Probably Dan.
It sounds like there's a number of board members that they go
And then
to that are I go through 10-day meeting.
Through four meeting.
So the question then would be is, can it be a board member who's attending already via
I think
the agency they work
that would be the
for,
most efficient.
but can also represent COC interests?
I think it was both represent COC interests and also bring back to the COC, like report back on what might be relevant to the COC.
Joe, you said you send staff, you don't go, you send staff.
No, I have staff that go there, yeah.
Jeanette, you want to do it?
Sure.
Okay. Thank you.
Yeah, thank you. That's great.
You make a motion?
No.
No, okay.
Hey, does anybody have any other announcements for today's meeting? Since being hopeful.
I just wanted to share that McCavin, we have our cooling station up and active, benches, misters, ice cold water,
Where is that?
148 Clara.
At your credit place?
Yeah. And we also are working on our mobile unit. So if you see the big crazy looking silver van, we're not picking anyone up, we're not supposed to. We're out delivering supplies and making things happen so that we can better serve the community. And we're utilizing it to go all over Mendocino County, so.
But Joe, you don't transport people, is that what you're saying? Okay, you transport your staff and yourself.
Staff and supplies, so.
So supplies means like drop off some.
Clean sterile supplies, safe sex kits, wound care, hygiene. We'll be doing HIV and Hep C testing out of the van as well. Thursday, we deliver lunches into some of the encampments. Yeah.
So when you say countywide, you actually will go to the coast?
Yeah, Coast is scheduled the second Friday of the month. We currently only have one day over there, and we are posted up at the food bank.
Do you have like a calendar?
Yeah, I can send one to you.
Can you send it to Veronica?
Absolutely.
And I'll send
Yeah.
disseminate it. Is it okay if it's public information?
Absolutely. It's
Okay.
public.
Then I'll send it to the full list and.
That's awesome.
Any other announcements?
I don't know if I just started doing this and I got appointed the liaison through City of Fort Bragg, but for California Victims Compensation Boards. So there's a variety of crimes that people could be involved with. I could help with police reports if that's what they need, but depending on the crime and the funding used for that, they're eligible for compensation through them. So it's just working with the individuals to navigate how you apply for the compensation board and funding, and I have brochures about that. I don't know if Project Sanctuary does that.
The project will help you with that.
Okay, yeah, so I don't know if other agencies had liaison.
It's kind of one of those things that because victim witness is.
Is the same thing? Yeah, so I would work closely with, if they're already in the justice system through victim witness, but this would be somebody who say they experienced domestic violence or another assault and it's not reported, we can navigate how to get compensation through that. So if they're having to lose work time for the crime, they could get compensated their income, if they don't have paid leave, or if they need therapy sessions and don't have insurance to cover it, this would cover it. If their car got vandalized, fixing that, if they don't have insurance, not safe in a home, they'll do surveillance on the home. There's like different categories that could qualify if they're a victim of a crime.
That's great.
Are you limited to city of Fort Bragg?
But I'm doing within the city back, I always help people navigate it outside of the city too.
So if like Project Sanctuary was to, or youth projects was to encounter somebody who's not a youth, they could refer them to you? Okay. Right.
Thank you, Jeanette. Any other announcements?
Just a question. Are the other agencies in town aware of the Ukiah Vagrant Watch and the things they are doing to some of our participants, clients, guests?
I'm aware of it.
Enlightenment?
Let's hear about it.
So it's an individual community member that owns the little golf place over at the, what is it? T-Up or something?
Yeah.
Next to
CBS, yeah, and at first he was just like the surrounding area right there where he's taking pictures of them, calling law enforcement on them. And now he's actually posting in other locations of Ukiah. My fear is the impact that it has on our participants and maybe them not knowing the law or, because he owns that spot in that building there, he's more than welcome to film and I guess verbally harass and chase people off his site. But now that he's going further out, venturing,
Sorry.
people, following people,
Seeing their names.
yeah. It's concerning. And I was wondering if anybody else was aware of it or
No,
monitoring it.
that'll be an interesting conversation.
He's pretty active on Facebook and some local media organizations are picking it up and reposting both his pictures and the pretty aggressive commentary.
Yeah.
People who are entering into the conversation. I know that he's had a pretty hostile relationship with UPD as well, so I think there's a business community and law enforcement community that are actually pretty impacted by his work, perhaps even more so than us, really, in some ways.
Okay,
They're
thank you, Joseph. I wasn't.
Yeah, I mean,
so worth to note, we are pointing to communities that have implemented zero tolerance camping ordinances and practices as like exemplary, examples for us or that we should be using. So like just they're showing, I think it's a representative somewhat of like a shift in our community towards like some tolerance and compassion is starting to fall.
So this could potentially like lead to like NIMBY type of stuff, like not in my backyard or.
We already faced
pretty much.
I think they're pushing pretty hard on policy level stuff.
Wow.
They're on a law enforcement response and a local law, state and county law, type, changes.
All right, thank you for the information.
Yeah.
I was not aware of that.
I'm not permitted to say anything to him directly unless he comes on McCavan property, so just be aware it's happening. And he is creating barriers for people, so.
He's entitled to his
Everybody has their right to their opinion. Well, they're doing that.
property if someone gets hurt.
If there's nothing else, the next meeting will be July 15th at 1:30 here in the Big Sur Conference Room.
Thanks, everybody.
Fifteen.
I know.
I'm like, that's terrible.
It's pretty.
Can we utilize this
We've talked to.
Wait, are we being recorded?
Oh, yeah.
Why don't we stop that?
Let me stop that.
And I don't know if it was you that emailed me, but somebody emailed me about a bus ticket.
I think it's cool. Okay, give us,
Yes,
go ahead.
chat.
Because we're concluding the meeting and recording. And everyone's gonna get up and leave immediately and not talk anymore.
Now we're all waiting.
Are we done recording?
No. Oh.
And hit end, right?
Just leave.
It does a weird thing.